Good morning, ladies and gentlemen. My name is Will Shipley. I'm here on behalf of a medical software company based in the Los Angeles area. We've been around for over 20 years working with laboratories scaling from physician-operated laboratories up through the larger reference labs and hospital labs. And when we started out, we were operating in a very different time. Right around the point that the World Wide Web hit public consciousness. And many of the laboratories that we went into were not connected to their clinic's networks. They were not connected to the internet. Very often they were one workstation in a closet somewhere or a series of workstations on an internal network. The world has changed significantly since then with the greater embracing of the internet and what capabilities mass communication has to offer. So if you have a core laboratory, you're handling your core competencies, you're delivering results with a rapid turnaround time, you're processing the doctor's orders, you're managing your QC, you're ISO 15189 compliant, where do you move from there? What can you extend into to improve your laboratory's functionality? And I would say that the target goals in this case would be to maximize your reliability using methodologies such as Lean or Six Sigma or other methodologies, to reduce your turnaround time to enable the doctors to rapidly receive your results, and to improve patient outcomes by whatever added value you can uncover. Whether that is pulling items together for the doctor to review or providing additional views of information or sources of information that they can appreciate. And to accomplish these goals, to accomplish these improvements, I would like to focus on three specific areas. One, embracing the opportunity that the internet and mass communication has to offer for laboratories. Second, to step out into the global ecosystem of practices and hospitals and laboratories and communicate patient health information with other systems with interoperability. And finally, to consolidate the departments of your laboratory into a single system that is a single point of contact with the outside world and give all of your departments the ability to share the same tool base. Now, some of the benefits of connecting out to the internet are the ability to keep data current when you're interacting with other systems and you're transmitting information back and forth in real time. You're able to get the most recent snapshot or send a most recent snapshot of patients' histories and patient status. It also opens up additional channels in addition to the technology of printing, remote printing, faxing, paper cubbyholes. You get notifications, texts, emails, all much wider ways of getting access to the doctor quickly. One example of such a thing would be an internet portal that your doctors could sign on to and trace results in real time. As results came available, they would be able to look them up. That's one path. However, if you include the orders side, you can get into computerized physician order entry. And that is an opportunity to dramatically reduce the turnaround time and increase the reliability and specificity of what's being ordered. There have been studies that show, that the turnaround time of laboratory results is dramatically reduced by having a CPOE system in place, especially in an inpatient situation. If you're a hospital lab, the numbers range from 25 to 50%. They're pretty dramatic. Furthermore, with a CPOE system, you can guide the clinician and their staff through making appropriate laboratory orders and help catch possible misorderings basically at the point of source, at the point of care. Now, one caveat about working with the CPOE system is that there's going to be some adoption challenges. There's going to be a bit of a learning curve. This is going to be a rather widespread project that is going to need all the stakeholders' involvement. One of the things that's going to change for you is that additional channels of information will be coming into your laboratory, where once a doctor might call client services to add on an order to an existing sample or change patient demographics, the doctor might, in this case, be adding on changes to an order via the system itself. Which means that to account for that, you need to have a workflow in your lab that will account for these additional channels of information coming in a pure electronic context. For instance, if your system has a notification queue where any changes to a patient's demographics or orders from outside the system are placed, you can then have dedicated staff who go through and reconcile those changes with the existing system. If you have a dedicated check-in space where online orders are filtered through, that is a point of reconciliation where a staff member can look at the order as it's in place in the system and compare it to what arrived in the bag and determine whether or not the electronic system has captured the order correctly. Finally, you're not limited to having some kind of review queue for just your online orders. We have a lab we've worked with in California that runs all of their manual accessioning through a second level review process where the paper requisition form is compared against what has already been entered into the system by their staff members. Now, doing this for all of your requisitions is perhaps not necessary, but having a dedicated percentage of those requisitions reviewed by your staff might be a way to improve the general reliability of your system. In addition to situations like an internet portal, there are other opportunities that arise. If you have connections to external systems with information on patient demographics or insurance information or health history, you can reach out to those systems and pull that information into your system. Now, this could be as localized as scanning a patient's medical health card and reading the data off of that card into your system, or it could be as real-time and global as reaching out to an eligibility database that is available online and pulling information about the patient that you've just accessioned and their insurance eligibility into your system. Additional channels of communication like emails or text notifications can be used to rapidly inform a doctor of critical values that have come up and allow them to get in touch with the laboratory and make significant decisions based on the patient's care. In addition to calling the doctor on the phone, buzzing their pager, what have you, whatever mechanisms we can use in this case to reach the doctor as quickly as possible should be a part of the toolkit. Furthermore, if your system supports sending out critical alerts, it likely also supports documentation of critical events, so that if a critical value comes up, your lab staff members can document that the doctor was informed and confirm that for your own records, that proper procedure was followed. One thing that I'd like to bring up in the context of communicating with external systems and open channels of communication is that you're likely going to encounter multiple representations of a patient. There are some situations, such as in Malaysia, where the entire patient population may have a national ID, such as Malaysia's MyCAD number. But even in that case, we've encountered some corner cases where patients don't necessarily fall into the same crowd as everyone else. Every citizen in Malaysia has a MyCAD number, but what happens if you're too young to have received one, or if you're a visiting dignitary, if you're carrying a passport from another country, or if your laboratory uses military IDs? Being able to support multiple ID spaces allows you to reconcile what information you have on file with your patient population and store and be ready for whatever comes in the door. Furthermore, if you're a reference lab that interacts with multiple clinicians who see the same patient, and you are able to create a consolidated patient record, being able to store the chart numbers for that patient for each of the clinicians you work with will enable your client services staff to pull up the appropriate information when it is needed. So we're creeping into a discussion about interacting with external systems. In the global health ecosystem, we've interacted with a lot of sites that are walled individuals. They don't interact much with the ecosystem around them, whether regional or global. And as pressure in the industry pushes laboratories to adopt better communication with electronic health record systems and hospital information systems, these walls are coming down. If you imagine the body of information on a patient as an organism, and individual facilities, be they clinics, hospitals, reference labs, as individual cells in this organism, then your interface to other systems is essentially a semi-permeable membrane, a cellular membrane, that important information can pass through to other destinations based on the environmental conditions and the needs that are being communicated from other cells. And therefore, the important clinical information that needs to be communicated in order to support the patient's health can be done so. Whether this is a communication between your LIS and your clinician's electronic health record systems, or to one of your hospital systems, the transfer of orders from these external systems to your lab and results back to these systems is going to be a pretty core competency moving forward. In the United States, this process has been driven mainly by the EHR systems, mostly driven by a need to fulfill medical use requirements as laid out by CMS, Center for Medicare and Medicaid Services. And that push in the industry has caused us to increase our system interface, the number of system interfaces that we've been putting in dramatically. Likely your country may have similar positions in place to set up these supports. And in addition to private connections, you have the ability to support epidemiology exports to public health facilities, to be able to submit your data to public health organizations that are tracking the spread of disease in your region. Being able to leverage each laboratory's patient history in an anonymized fashion will provide a great deal of support to your local community. Now, some things that I want to bring up while we're talking about interoperability, some challenges that you'll come up with. First, as I mentioned before, not every organization is going to use the same patient ID. Even if you're in a situation with a national ID such as the MyCAD, there are still going to be some people who fall through the cracks. In that case, when you're organizing a point-to-point connection with another system, whether it's an EHR or an HIS, you're going to want to be able to agree on identifying information to identify each patient. Some ID space that the systems can communicate into to make sure that orders and results all reference the correct patient. Another question that will come up is whether the systems expect to use the same codes, whether you're discussing diagnosis codes such as ICD-10 or SNOMED, or you're discussing order codes such as LOINC. These are tools that will enable you to bring the systems into sync more effectively. And finally, the meaningful use requirements in the United States require that lab results be transmitted as structured data, individual items, individual lab results, which could then be transformed into other clinically useful formats. However, the report that you generate as a lab is equally useful in that the content, the formatting and layout of the report provides some medical guidance to the doctor as well. And so I would like to suggest that going forward with interfaces, consider a hybrid approach where you are, in addition to sending your medical data via most likely HL7, the HL7 2.0 standard, or 2.7 standard, also sending a copy of your lab report, which would previously have been in paper, in, say, a PDF, as a PDF file, or if you want to send it in a more electronic format, HL7 CDA. There are a couple of other actors in the interoperability sphere that I would like to point out. One would be the HIE, Health Information Exchange, and these would be large projects that are reaching out to clinicians and laboratories to standardize the way in which orders and results are communicated between the facilities, trying to take what is a complicated point-to-point problem and make themselves the hub in a wider network. Now, these are usually very large projects with high operating budgets. We've worked in Canada we've worked in Ontario with OLIS, which would be one example. I understand Singapore also has some motion here with IHIS in a similar vein. These are large projects that you're likely going to encounter more communication with. Another option would be interface engines, where your on-staff IT personnel would use a product like Mirth to take the HL7 data stream coming out of your system and break it out into as many flavors or dialects of HL7 as needed to communicate to your various clinical partners. Since HL7 2.7 is a widely held standard, it is not necessarily a standard where everyone is strict in the implementation. And so being able to react to the various flavors of HL7 that you will encounter in the wild is going to save you some heartache. In order to support this reaching out to your regional and global health community, it will be useful as an institution to have a single point of contact with the outside world, where your orders and results can all flow in from the outside world and be disseminated to whichever departments need the work to function, and that the information can flow back and be presented as necessary for the clinicians. To that aim, we are recommending a consolidated laboratory where all of your departments are brought in to use similar facets of your laboratory information system. And this allows your departments to more fully use a common toolbox available to the entire facility. For instance, if you have various departments whose turnaround time you want to be able to monitor, turnaround time dashboards hooked into the laboratory information system can allow each department to track whether their sample volume is exceeding turnaround time. And this provides instant feedback to the departments as to how they're operating. This will allow you to improve your key performance indicators. Now, dashboards are not necessarily limited to inside the laboratory. There's at least one study that showed where a dashboard was placed in the emergency department of a hospital to indicate to physicians what the status of their outstanding orders was, whether it was in progress or complete. And the study found that this dashboard increased the physician's confidence in the laboratory's work, reduced the amount that they actively logged into the EHR to check to see if their results were available yet, and dramatically reduced the number of repeat orders that had been placed by the department. So being able to, again, reach out with additional channels of communication and provide more detail to the clinician will add value to your laboratory and improve patient outcomes. On a more internal perspective, being able to audit when various staff members have viewed accessions or lab reports, have printed them or made modifications, will allow you to track for adverse events inside your laboratory. Having a secure core of users and access controls that allow certain users to see their appropriate responsibilities allows all of the departments to gain access to these tools for tracking proper use of the system. Furthermore, in addition to having auditing of what people are accessing, being able to have a usage log of how your tests are being run on your instruments, how your reagents are being used, will allow you to confirm whether you're seeing an acceptable volume of tests based on the orders that you're expecting to see. If you have access to a document storage solution, being able to scan patient requisitions and patient insurance information at your accessioning stage will allow you to get rid of your files and files of paperwork and move the lab into a more paperless environment. This is especially useful if your document management system can be pulled up side by side with your LIS so that, for instance, at an accession review stage, a digital copy of the requisition form can be compared directly to what's in the system. A rules engine that is built into your system and available to the departments enables a number of advanced processes, whether you're supporting auto reflex or the ability to automatically annotate or flag a particular accession for further review by your troubleshooting staff, or with the support of auto verification rules at the instrument level. Certain departments such as biochemistry, routine results can just be released, but abnormal results and results for more unconventional tests such as cardiac or tumor markers can be held for further review by your lab staff before release. This again will streamline your turnaround time, and it will help you codify in the system the practices where you want to pull your accessions for further review. Finally, integrating the departments into one system allows the laboratory to allows your LIS to provide specialized functions for those departments that hook again into the larger data flow in the larger system. For instance, in microbiology, a dedicated microbiology module could support paperless microbiology entry to store day-by-day analysis of the cultures as they grow, or could allow bulk processing of throat cultures and urine cultures at the 24-hour and 48-hour marks. A cytology module could handle the security permissions to assign different cytotechnologists different workloads for pap smears, to monitor the compliance with those workloads, to provide for your automatic QA process of holding slides back for review by a senior cytologist, or to generate reports that are intended for public health. Similarly, a histopathology support module could support the workflow processes of grossing your samples, constructing blocks, generating slides, special stains. The histopathology module could also assign pathologists specific cases for work and staff members to those pathologists, and provide support for dictation of the final analysis and the attachment of referral reports. In the United States, we're seeing a major boom in toxicology labs, and a module that is dedicated to reconciling the prescriptions that a patient is on with their current lab results to indicate whether they are in compliance with those prescriptions or not has been very useful to that sphere. And this is, again, a use case that is well supported by an automatic rule system in your laboratory information system. With a rule system, you can codify the relationships between prescriptions and lab results and provide a great deal of workflow support to your laboratory. So, stepping away from this talk, I would like you to consider the ways in which you can use the internet and use additional streamlined methods of communication to reach out to your doctors and provide additional support to them via internet portals, emails, text messages, notifications. Consider the ability to reach out to other systems and build a web of interconnecting systems operating in a regional and global medical community. And the opportunity to pull your laboratory together into a consolidated voice in this conversation, to give all of your departments the ability to enjoy all of the features of your core laboratory system. These are the paths that we see laboratory information systems moving in the future, and we are looking forward to exploring them further. I'll be happy to take any questions that you have.
I noticed that when you were talking about the tools that the LIS provided, that you didn't mention anything about QC.
I would consider QC, well, I didn't want to steal the thunder from the QC presentation this afternoon. I imagine we're going to be going through QC rather thoroughly there. But I would consider an integrated QC process to be another strong argument for consolidating your laboratory's work. Very often QC is performed at an instrument by instrument level, and if you're able to pull that information into your system, then you can review it basically from anywhere that your laboratory information system has a workstation.